COVID-19, since its advent, has affected different persons in different ways. So far, people residing in psychiatric facilities and some receiving treatment are also at high risk of being infected. People with psychiatric conditions and substance use disorders, especially those in psychiatric hospitals, are even at higher risk because of the difficulty in evaluating their medical symptoms and history. What measures should a psychiatrist observe when on duty? What are those salient measures that could be taken when a psychiatric patient exhibits symptoms of COVID-19 and the treatment mode? These and more on Panorama today from the Lagos Network Center. I am Hingino John Adams. Thanks for joining us. Thanks for being with us. 229 new confirmed cases of COVID-19 have been reported in Nigeria by the NCDC, 90 in Lagos, 27 in Katsina, 26 in Imo, 23 in Kano, 14 in the FCT, 12 in Plateau, 9 in Ogun, 7 in Delta, 5 in Borno and Rivers, 5 each in Borno and Rivers, 4 in Oyo, 3 in Gombe, 2 in Osun, while Anambra and Bayelsa have 1 case each. Number of confirmed COVID-19 cases in the country as at 25th May is 7,839, with 2,311 patients discharged and 233 deaths recorded. Training to enhance capacity of health workers who are on the front line in the fight against COVID-19 has continued in Taraba State. This time, the Center for Initiative and Development, in collaboration with the Nigerian Center for Disease Control, took the capacity building to the doorsteps of the Federal Medical Center, Jalingo. Joseph Otsen completes the report.
Importance to us because we are the healthcare providers, and it's a timely training for us to step it outside to see how we can manage this COVID-19 in our community
and help to minimize the transmission from human to human, and as well help the affected persons to know what is important to do at the time of maybe quarantine.
Our passion is to ensure that our frontline healthcare workers are first of all protected through the knowledge they have on personal protective equipment and infection prevention control, and they have the necessary skills and competencies, knowledge on how to manage these patients when they come through the doors and the gates of our hospitals.
This 5 weeks workshop is to build capacity of health workers saddled with the responsibility of managing COVID-19 patients without jeopardizing personal health. The training, according to the organizers, is going on in 7 states, including Adamawa, Bauchi, Benue, Gombe, Nasarawa, Yobe, and Taraba State. Over 3,000 persons are expected to benefit from the training. In Jalingo, Joseph Sound Otsen, NTA News.
With hospitals, the continuous synergy between the Presidential Task Force on COVID-19, the Federal Medical Centers, and other hospitals in Lagos State is yielding positive results in the fight against coronavirus in the state. Nososula reports that the medical facilities are constantly sharing information and strategies to improve their performance at effectively tackling the pandemic.
The country's number of confirmed COVID-19 cases continue to rise. There are concerns over the preparedness of the federal public health facilities to combat the pandemic. With Lagos State having over 3,000 confirmed cases, concerns over a wider spread have soared in the economic hub of the country. Being the first point of contact in an emergency situation of any COVID-19 outbreak, NTA News during the week conducted an investigation based on direct observation of federal medical hospitals and health facilities in Lagos on their level of preparedness against the spread of the virus. Our findings showed that federal facilities, including the Lagos University Teaching Hospital, are well prepared in terms of preventing and containing COVID-19, as well as providing critical care to infected patients.
If you walk around the premises, you find out that our gates are manned by security personnel who are in some protective gear themselves, and they all have thermometer guns.
They also commended the federal government for the deployment of COVID-19 starter packs to ensure the protection of frontline workers.
I'm happy to tell you that we have not had any death from COVID-19 among our staff in this hospital. And if we've had COVID-19 with us for more than 4 weeks now, it means, it goes to show that at least there's some judicious management in the use of PPEs in this center.
They advised residents to adhere strictly to the COVID-19 preventive guidelines stipulated by the federal government. In Lagos, Nosa, Osula, NTA News.
Post-COVID-19 survival of most small businesses will depend largely on application of innovations by owners. Abolade Salami, who interacted with some small business operators, reports on plans along these lines.
Economies strive on small and medium-scale enterprises, not only in terms of job creation, but economic diversification and revenue generation accruing from these businesses. Its huge impact on Nigeria's gross domestic product is estimated at about 47.8%, with about 37.1 million MSMEs in the country. These statistics, however, attest to the relevance of the sector.
Again, we're seeing a shift from routine or conventional brick-and-mortar businesses to virtual interface between business and customers. So that would also lead to some businesses becoming completely unviable. So I think in the first place, it takes some time for global consumption and global demand to recover.
Sunday Chukwu, a food vendor like other entrepreneurs, says in the last couple of months, he's been confronted with the challenge of drastic drop in revenue due to the coronavirus pandemic. But this challenge, he said, has provided an opportunity for him to come up with innovations on how to grow his business post-COVID-19.
I may God help us, because as I did like this, if not because interstate motor no they run, if I don't go my village, go they do farm work. But I know that by the grace of God, God will still help us. Learn many things, because even how to manage things, especially by managing things, because like before, if I say food finish, I will go and drink. But ever since this thing started, everybody have another sense.
While the situation requires more efforts on the part of Sunday towards maximizing profits, Kalu Mabel Tisi described the coronavirus pandemic as a clog in the wheel of progress.
The sales, ever since we opened, after the relaxing, it's nothing to write home about. You can come out in a week, you cannot boast of 2,000, 3,000. You won't even sell even a pin.
Although small and medium-scale businesses are gradually picking up following the ease in the lockdown, most entrepreneurs say a new approach will be infused into the scheme of things in order to survive the times. In Lagos, Abolade Salami, NTA News.
Let's now turn our attention to the military. The Nigerian Army says it will continue to contribute to ensure the war against insecurity and COVID-19 is won. This was re-echoed when the Nigerian Army Ordnance Corps distributed palliatives to its immediate community in Lagos. Lynn Leneke has details.
Many residents of Empire Community in Surulere local government turned out en masse to benefit from the palliatives provided by the Nigerian Army. The palliatives were offloaded from the truck and arranged with physical social distancing protocol observed. The beneficiaries came forward in an orderly manner while accepting the palliatives under the supervision of the representative of the Corps Commander Ordnance, Major General Akintade.
I didn't even think, I didn't even dream about it, but God just do it surprise. So I'm so happy.
To thank the government for this provision, because it's going to be useful to all households that has received it.
The gesture, the Nigerian Army says, is to cushion the economic effects of the partial lockdown.
So the chief feels that he has to identify with some of these Nigerians, and this particular community is our neighbor, and we have had excellent relationship over the years.
COVID-19 is real. You shouldn't take any risk.
The Nigerian Army expressed determination to sustain the tempo of protecting and defending the integrity of the nation and its citizens. In Lagos, Lynn Lenake, NTA News.
You're still watching Panorama, coming to you live from the Lagos Network Center. We now take a break. The program continues shortly.
Experience unlimited super-fast internet access from Intel 4G. Intel. Live more.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
Thanks for staying with us. With COVID-19 currently ravaging the world, different people have been infected while some have been grappling from stress arising from either contracting the virus or to stay safe. Joining me live via Zoom to discuss COVID-19 from the perspective of a psychiatrist is a consultant psychiatrist, Dr. Nkem Ndionuka. Thanks for joining us on the program, Dr. Nkem.
Thank you very much. A pleasure.
All right. As a psychiatrist, how do you see the ongoing COVID-19 pandemic?
Okay. As a medical practitioner first, before a psychiatrist, I feel that the health system is overwhelmed by this pandemic. So every hand should be on deck to palliate or alleviate the problems that are associated with the COVID pandemic.
All right, now what are your areas of concern even as COVID-19 related cases spike globally?
Okay, my concern is the health implication, the mental health impact of COVID-19 on the people generally. Because a lot of people have experienced some grief in the position that they've been called down from doing what they usually do, they've been restricted, they've been socially isolated, and all these things go with some losses. People don't go out as usual again. So there are a lot of problems associated with the COVID-19 pandemic and all the measures the government is taking to see that it does not cross to many people.
Okay, now let's now take a shift to your area of specialization. Are there reported cases of psychiatric patients contracting the virus? If any, how are they being managed, especially now that a cure is yet to be found?
Is at the middle of the whole management of this pandemic because you have to manage the general public who is already in a state of anxiety.
There's something we call the anxious world people. Everybody is anxious. Even those who have not contracted it are afraid. People who have contracted it are stigmatized. And those working at the front line, I mean the medical doctors and other health workers, they are anxious. So in as much as we have not admitted or don't have particular psychiatric patient, but we believe that almost everybody now has gone down with stress. This is a distressful period. And of course, when we are talking about psychiatry, we're also talking about those who use substances. And we have known that a lot of people now have gone back to using substances because of boredom or because of there's nothing to do or even loss of hope. So categorically, we cannot say that this is a patient, psychiatric patient, this has to manage it. But we believe that government should come out with a guideline for such management. But generally now what we see is those who are in distress, who are conscious of their tomorrow and they come down with stressful reactions and then they come to psychiatrists or they call on psychiatrists to assist them. And of course, those who are already having the illnesses, because they could not have access to their medications on time, we have a lot of them relapsing. That means going back to their former symptoms. And also, that's a very major concern to us. Thank you.
Okay, you talked about anxiety. It is true that many people are anxious. How do people now deal with this anxiety?
Yeah, dealing with this anxiety of the COVID-19 pandemic is just taking things one at a time. Because people are bombarded with a lot of stories, a lot of news, a lot of information. But people tend to be so anxious like many people wait till evening time to know the number of affected people in Nigeria or elsewhere. So one of the ways of dealing with this anxiety is believing that it's going on, the government is doing something to try to alleviate the problem and make sure that more people do not contact the disease. That's why we put in place social isolation, all this sanitization, and all the things that one has to do. And of course, be hopeful that very soon a cure will be possible for this illness.
Okay, you just spoke about people that are anxious. Let's now talk about this particular group of people that don't seem to be anxious about COVID-19. Up till now, some Nigerians still believe that COVID-19 is a ruse. How can this class of people be assisted to see the reality on ground to make them stay safe?
Yes, one of the major problems people have with denial. And once you're in a state of denial, you have a big problem. You have a big problem because you don't know you have a problem, so you're in denial of it. So the moment you accept COVID-19 as a reality, then you start obeying all the instructions given in order to avoid contacting it. And even if you are contacted, you know that it's not a death sentence. There are treatments, there are facilities that are laden with the treatment of those who have COVID-19. Then, at that stage, you have to come up. But if you cannot be in denial and say, look, I cannot, there's nothing like COVID-19 or is a disease of the Western people or whoever, then you are not doing yourself any good. Because you're not going to obey all the instructions and you go out disobeying the government rules, and when you contact it, then before you even come up with it, it's already in a chronic stage. Now, if you're not in denial, every small symptom, you'll be able to know that, look, I am not breathing well, I'm coughing, I should go for a doctor, I should call a healthcare facility that these are my health positions. I think one of the major things we are doing, or the press will be doing, is keep on talking to people, keep on giving the jingles, keep on letting people know that this COVID-19 is a reality. It's not a ruse, as many people may think.
All right, doctor, without mincing words, the coronavirus has changed the world order. What is the best approach to staying safe and sane around this time?
The government has stipulated, I think the most important thing is that many people should not contract this illness. It's already real. So the government has instituted a lot of measures and those measures are to be obeyed. If I must wash my hand as much as possible, if I must use sanitizer, I stay home when I don't have anything doing outside, then I'm doing good, not only to myself, but to other people who are out there. Because as has been said, the coronavirus does not go to people. People go to it, people carry it around. So if we keep on going around and carrying it, that means we are going into the community spread of it, and that is going to be very dangerous for the nation because we may not have the facilities or the manpower to handle it at that level.
All right, now how can the psychological effects on COVID-19 patients, even that of health workers, be mitigated?
Yeah, the psychological effect of health workers, especially because those who are on the front line, they have a lot of issues confronting them. Some of them have left their families for 2 weeks or 3 weeks. They're afraid even to go home when they're discharged to go home. Then they're thinking what will become of them when they finish the treatment. And I think some people say that after this COVID-19 pandemic, there's also going to be mental health pandemic because a lot of people will come with psychological problems. Some of the health workers who are in the front line will be feeling guilty. They'll be feeling that they've not done enough for the patients. And of course, when you have a lot of dead people, many people dying in front of you, you could have helped, but you don't have the means to help them. That will also act on your psyche later. Then for the patient themselves, of course, see a patient. Now, people stigmatize ordinary people who have illnesses, not talk of somebody having COVID. Because we must know that if you have COVID in your neighborhood, many people will start avoiding you. So there will be stigma, and when somebody is stigmatized, it's also psychological distress. So one of the ways to go around this is that a lot of organizations, psychiatric, psychological associations, in fact, employee assistance programs, they have come out with even numbers, anonymous numbers, toll-free numbers, where you can call if you're having any mental health or psychological distress, so that will be helped by professionals.
All right, doctor, you mentioned mental health pandemia, that's post-COVID-19. What's your advice to Nigerians?
My advice to Nigerians is that this illness has come and we should take it easy. We should calm down and watch how the trend will follow. In history, this is not the first pandemic. There are other pandemics who have come and gone, and people survived and moved on with their lives. I know that, or we know that there are a lot of economic downturn. There are a lot of people who are afraid they're going to lose their jobs. But if you've not lost your job, why should you be afraid of losing your job? And even if you lose your job, there are other things you can do. So you should wait until things, have other plan Bs in life and move on. I know that because children are at home, many parents are stressed up. Many parents, look, they are not going to work, so they are very stressed. But what we're saying is that, look, take it one at a time, be closer to your family, exercise, and do some other things that will make you feel fine. And above all, always contact your health staff.
All right.
It is online or anonymous.
All right, thank you very much, Dr. Nkem Ndionuka, for sharing your thoughts with us.
Thank you. You're welcome, ma'am.
All right, moving on now. All the guidelines issued by the Presidential Task Force on COVID-19 are adopted by INEC for the conduct of elections during this period, and majority of the activities are to be carried out through online. This was contained in a 10-point policy document for the conduct of Edo and Ondo governorship elections. Mie Ogidi reports.
It is countdown to the Edo and Ondo governorship elections, and the entire political spectrum has to adjust to the realities of the moment. 10-point policy document is out from the INEC headquarters, adopting all the guidelines issued by the Presidential Task Force on COVID-19 and NCDC for the control of coronavirus.
In terms of political parties, the nomination processes will be done online. In terms of accreditation of the media, it will be done online. in terms of the elections itself, we are going to make sure that all our election officials, we provide them with protective equipment. But it is mandatory for any voter coming to vote in any election to wear face mask. With no face masks, no voting.
How campaigns and party primaries will be conducted without large gatherings is a national question. But in the wisdom of INEC, just as football is played in some countries without spectators, campaigns without gathering is preferable.
What we expect from them is to make sure that in organizing their campaigns and organizing their party primaries, they conform to the dictates of physical and social distancing. Political parties will still do campaigns the traditional way, but it will not be as robust as we had it previously. They are going to utilize more of the radio, utilize more of the television, utilize the newspapers, and also utilize the social media.
For the 9 outstanding by-elections, no date yet. Mie Ogidi, NTA News.
It's a package from Lagos. Thanks for watching and good afternoon.